Greetings to colleagues from around the world. I'm really honored to be here and represent AORN as a partner with Compass in growing surgical capacity. Compass has gathered a really esteemed panel here of nursing leaders, and I'm really looking forward to a great discussion today about building surgical excellence. So what is capacity in surgical care? Here is my simple definition: the right resources for the right surgical care at the right time. Individuals, team, and physical resources with optimal outcomes for the patient. Really simple to describe and not so simple to achieve. We all want optimal outcomes for the patient, and the pathway to that is complex. Why surgical capacity is important, I thought, really depends on your view. For the administrator, surgical care accounts for 60% or more of the financial bottom line of a hospital and a significant amount of the reputation. High functioning teams bring safety and efficiencies to a high cost and a high revenue area. The view of the surgeon is that a well-educated and highly competent surgical team enables the surgeon to give timely care and to concentrate on the high-risk technical aspects of the surgical procedure that then maximizes safety and efficiencies. And we all know surgeons like to do lots of cases. The view of the patient is that they expect us to provide safe, high quality, and timely care to improve their health. And we all want happy patients. So what's the view of the perioperative nurse? I thought it's really about having the resources needed to deliver great care and work with a great team that they can trust and grow with. The perioperative nurse comes to work to deliver great care, and they want to be proud of that care. They want the education and resources to continue to grow as professionals. They want safe levels of staffing, which means they want a strong team culture that keeps great nurses and attracts great nurses as their colleagues. As a career-long perioperative nurse myself, as I was reflecting on this, I thought there's a great many things about perioperative nursing that really have not changed a lot. Perioperative nursing is high tech, and it's constantly getting more and more technology that evolves. It's also high risk. Evidence-based practice drives the prevention and safety that are needed to deliver safe care. There is constantly the pressure of throughput and time in this environment. Minutes are risks for patients, and so that constant pressure is always there. The team dynamics mean that the communication skills are as important as the clinical skills in providing safe procedures. The care in this area is highly specialized. You can't just have the emergency room or the ICU nurse drop down and cross cover for breaks. You can't just go home when you're tired. Cases have to be finished regardless, right? And the on-call and after-hours needs are a part of the workload, which makes it extra challenging in terms of staffing. Most importantly to me, the patient gives us their sacred trust to advocate and speak for them when in our care. That hasn't changed and won't change. But some of the things that have changed have been big. The pandemic was a huge disruptor of care delivery and the impact on healthcare resources. There are staffing shortages globally. It is harder to recruit and it's harder to retain good staff. There's estimates of 20% of nurses planning on retiring within the next 5 years, which means this problem is not going away soon. Post-pandemic surgical volumes, while they dipped for a while, definitely are growing. So the need for perioperative nurses continues to be a challenge. And the evidence has increased that does demonstrate standardized evidence-based education improves patient outcomes and decreases the cost of care. So the investment definitely is worth it. For those of you not familiar with AORN, the Association of Perioperative Registered Nurses was founded in 1949 to establish a national community for operating room nurses who sought to share best practices for patients undergoing surgery. Today, we unite and empower perioperative nurses, healthcare organizations, and industry partners to support safe surgery. You can see our tagline at the bottom of the slide. You can see our vision on this slide, and I love that, and I think it really fits with today's topic. AORN will provide indispensable evidence-based resources to establish the standards of excellence for each phase of perioperative nursing care to achieve optimal outcomes for every patient, every time. We are the largest perioperative specialty nursing association and are proud of our reputation for supporting excellence in surgical care. So this is our position statement supporting the perioperative registered nurse circulator for every patient. And I added it here because I think it really speaks to the impact of the perioperative nurse on patient outcomes. Patient care in the perioperative setting is dynamic in nature and depends on the clinical knowledge, judgment, and clinical reasoning skills possessed by the perioperative nurse. And improved patient outcomes have been demonstrated with improved staffing, enhanced work environment, and better educated nurses. All the things we're talking about today. There's much more in that position statements, but I thought those two pieces were really helpful for our topics today. And we do know that quality education can save lives. Here's a few comments of how this pertains in perioperative nursing. Studies from the National Institute of Health show that a root cause of medical errors often results from deficiencies in education, training, orientation, and experience, again substantiating the importance of quality education. Staff turnover is costly to all departments. And in the US, the average right now is running at about 27%, which is very high. Career advancement and continuing education are often cited as positive influences on employee retention, which we all want. Professional practice based on the highest standards of evidence and lifelong learning will continue to bring the highest standards of patient care to the nursing role, which is what nurses come to work to do each day and ways we can support them. AORN has worked with Compass to develop a pathway for building surgical capacity through a standardized process for perioperative education. You can see the key components here on this slide, and I'd like to share a little bit more about these elements. AORN believes strongly about a structured, standardized process for entry into practice, and we have a position statement about this. We call it residencies here. Here's a couple of key elements which I believe are helpful. Perioperative registered nurse residency programs are essential to assist in decreasing the theory-practice gap and increasing confidence, knowledge, and competence, professional interdisciplinary communication, and nurse retention rates. The impact of a strong standardized educational program is many. Leads to increased job satisfaction, increased critical thinking skills, and decreased turnover rates for nurses, and it provides cost savings to healthcare organizations. Nurse residency programs lead to improved nursing practice, increased clinical competence, and improved time management and leadership skills. They also improve communication and collaboration skills, which are essential in the perioperative environment. The first element in this career pathway is Periop 101. It is the standardized entry to practice for all perioperative nurses, whether new grads or experienced nurses. It brings the highest standards of evidence to the knowledge and skills needed for competent practice, with topics such as sterilization, positioning, medication safety, electrocautery, professionalism, and I could go on. We know from our customers that it reduces staff and educator training time by having this structured program, that it leads to increased nurse confidence in evidence-based practice skills and knowledge, that it does lead to increased retention, critical thinking, and application skills. So who is it designed for? We are really proud not only of the quality of the information in this program, but the variety of ways that the information is delivered, including interactivity with real-world scenarios, animations, graphics, and clinical illustrations. We have gamification to help drive student engagement and retention throughout the learning process. There are micro-learning elements to help students recall, retain, and transfer knowledge. And we have video demonstrations of clinical techniques embedded in this program. This program is very successful and continues to grow. Over 4,000 organizations have used this over the years, and last year alone, over 13,000 nurses were enrolled in this program. We are very proud of the success of this program. All of these programs on this pathway are evidence-based and reinforce AORN's guideline for perioperative practice, the gold standard for surgical, patient, and worker safety. These all are also continually updated as the evidence changes to reflect the ongoing improvement of excellence in surgical care. We believe that safe care comes through knowledge and skills that have been validated by a standardized educational process, which this reflects. After the PeriOp 101 as entry into practice, the PeriOp 202 courses continue with specialized procedural content. The pediatric course addresses this special patient population, so important in the care that we deliver. The quality improvement courses teach ongoing care improvement processes for the nursing staff to be able to do that. And the CNOR prep course reflects the highest of perioperative knowledge in certification. So AORN and Compass Health Consultancy, a really exciting partnership. Together, we are working to standardize education for building your surgical capacities with high quality education for highly effective perioperative nurses. Thank you so much for including me today. I look forward to hearing more today from this esteemed panel of colleagues. Thank you.